Hello, my name is Marsha, and I'm the moderator for this lightning a session for the lightning talk sessions. Our first program is going to be on harnessing AI for research, a comparative tool and training program for smarter information retrieval. And the presenters are Keren, Moskal, and Cassandra Gorton. But right now I have a few introductory statements. We have a code of conduct, and I have put that in the chat. If you have any problems with code of conduct not being enforced, you can request help from the email that for the URL I gave, the address I gave in the chat. Okay. Then also everybody should keep their mics muted. Please, if you have questions, you should put them in the question and answer. We will leave a few minutes after the speakers have been able to present, which will be for the next 10 minutes. Then we'll leave around 4 or 5 minutes for questions and answers. So you can enable captions at the bottom of the screen. And I think we're ready to be started. And I'm going to introduce the two speakers now. Keren Moskal is the clinical librarian and education lead at Monash Health Library in Melbourne, Australia. And Cassandra is the manager of access and discovery at the same Monash Health Library in Melbourne. Well, please welcome Keren and Cassandra. It's all yours.
Thanks for the introduction, Marsha. I'm Cass Gorton, and I'm joined by my colleague, Keren Moskal. So I'd like to start off today by acknowledging the traditional owners of the land on which I work and live, the Wurundjeri Woi-wurrung peoples. I pay my respects to them, their culture, and their elders past, present, and future. In this session, we'll explore the process of developing a matrix of AI tools and the creation of a complementary educational series. We'll also showcase how the tools were evaluated and share practical advice for designing an effective education program, including delivery, promotion, and evaluation. Monash Health is one of Australia's largest public health services and the largest in Victoria. Our clients differ from those of a typical academic library. They're practicing clinicians, including doctors, nurses, and allied health professionals who require immediate expert support for patient care, research, and education. Our library service, with physical branches in 5 hospitals, is constantly evolving to stay current with developments in librarianship, technology, and patient care. One of the ways we achieve this is through team-based learning. In 2022, we launched an initiative focused on exploring digital tools that support the research process, particularly those that assist with searching, citing, and screening. Our librarians trialled and evaluated various tools, assessing their potential to improve research efficiency and accuracy. We shared our findings in team discussions, identifying each tool's strengths and limitations. While this internal knowledge sharing was valuable, we soon recognized the need to convert our learning into practical, actionable advice for both our team and our wider user community. This led us to ask, which tools should we recommend, for which tasks, and why? To offer structured guidance, we began by focusing on citation mapping tools. We compiled a comprehensive list and evaluated each tool based on key criteria, such as cost, ease of use, product support, and import-export capabilities. To make the information easier to navigate, we rated and ranked these tools, providing clear recommendations. We identified best for use cases, helping users quickly determine which tool best met their needs. We presented these findings in a citation mapping matrix, as seen here, which offers a side-by-side comparison of tools based on their relevance for different research tasks. This matrix was embedded in our literature searching guide, a resource accessed over 1,000 times each month. We also promoted the matrix through a training program, which Keren will expand on shortly. This process of evaluating, refining, and sharing practical guidance not only deepened our internal knowledge, but helped our users confidently navigate the increasing complex digital ecosystem of research tools. Since the release of ChatGPT in November 2022, there has been a rapid surge in discussion about its potential to transform information seeking, research, education, and even clinical practice. Predictions range from enhanced productivity to concerns about the tool's potential to disrupt entire industries. Amid the excitement, there is also caution, particularly around the risk of AI hallucinations, where ChatGPT generates inaccurate or entirely fabricated information. In the research and library space, these hallucinations presented a unique challenge. ChatGPT could produce citations that sounded legitimate, but they didn't actually exist. Fortunately, in our library service, such cases were rare. Only a small amount of users submitted requests based on false citations generated by the tool. As AI adoption grew, we recognized an opportunity to lead and promote best practices in its use. In response to the rise of ChatGPT, we developed and delivered a comprehensive webinar. Our aim was to equip users with the knowledge to use AI tools responsibly and effectively. To advance our AI education program, we adapted our citation mapping matrix to evaluate AI-powered research tools. We identified 23 tools and assessed them using key criteria: source reliability, whether tools drew from credible sources or unverified content; user interface, the use and whether technical skills were required; full text access; cost, and support resources. Using these criteria, we developed a ranking system that offered clear, concise summaries of each AI-powered tool. Mirroring the structure of our citation mapping matrix, the rankings were designed to be both user-friendly and actionable. To demonstrate the breadth of our evaluation, we also included an honourable and dishonourable mentions list. This highlighted that our assessment extended beyond the top rating tools. The resulting matrix became a valuable addition to our ongoing AI education program. This thorough evaluation process has further strengthened our role as a trusted source of guidance on emerging technologies, empowering our users to search AI and use it in both research responsibly and effectively.
Thanks, Cass. The library holds regular training sessions on evidence-based practice and literature searching and digital literacy. So we decided to add a series to promote these learnings to our patrons. We plan the AI series training sessions using instructional design methods. This methodical approach ensures necessary components are covered and that the training meets learners' needs. We started by looking at the training objectives and identified that we wanted to build awareness of online and AI tools used in research specifically, and specifically when literature searching. The sessions would be pitched to a wide audience, including clinicians, researchers, educators, librarians, and healthcare students, and pitched to new and existing users of AI. A lunch and learn style series of recorded webinars would meet the needs of our patrons, who are located across sites with varying schedules and competing demands on their time. And promotion was in line with our regular activities, including newsletters, intranet listings, and direct emails. Evaluation also was in line with our regular activities, and these evaluation mechanisms would track participation and gain constructive feedback that enable us to improve training. Based on this information, we created a series of 4 webinars, starting with an introduction to ChatGPT in 2023. This was followed by citation mapping, AI-powered searching, and an update on ChatGPT and other generative AI tools through into 2024. Each webinar highlighted unique awareness of functionality, usability, and limitations. The ChatGPT and Gen AI webinars focus specifically on building awareness and demystifying these tools, as well as ensuring patrons were aware of data security, the way in which results were generated, and any limitations to the tool. ChatGPT and then later on Copilot and Claude were demonstrated to show use cases around generating lists of keywords for searching, formatting spreadsheets, etc. It also gave tips on creating effective prompts. The citation mapping webinar focused on explaining the process of using a seed paper for forward and backward citation searching, and also using digital AI-driven tools to search or scrape research from papers and information from open access platforms. It was important to make patrons aware of how these tools worked and where citation data was drawn from. We demonstrated using 3 tools that we had identified from the AI matrix that Cass mentioned earlier. We demonstrated Litmaps, Citation Chaser, and Local Citation Network. So these platforms were large aggregators of citation data and really highlighted the use cases that we wanted to present. And the AI-powered search webinar focused specifically on tools that use natural language queries of online repositories. So particularly when we use sort of keyword and phrase searching. There are a huge range of tools, as I'm sure you're aware, available in this area. We chose to demonstrate Consensus, Semantic Scholar, and Lens.org. We wanted to emphasize how these tools can be used to supplement a traditional database search and not necessarily as the sole source for a literature review. So just to finish up, we identified challenges through the creation of the AI matrix and training sessions. So as we all know, this is a rapidly developing and changing environment. So it's been really difficult to keep ourselves up to date and our patrons up to date with AI tools and specific regulations and guidelines for use of AI in healthcare settings and when publishing. We aim to continue our work by updating the matrix based on any changes of interface or subscriptions or usability of the tools, and also integrate these learnings not only into these training sessions that we have already run, but into all of our regular literature searching training where this is pertinent. And it's also, of course, important to continue our team learning practice and our continuing PD. We are really active in attending PDs such as this wonderful conference today, but also joining community of practices, as well as keeping up to date with readings and recent research that come out. So thank you very much for listening to us today. We're happy to take questions.
Yes, please put the questions in the question and answer box. We only have a few moments to respond before the next session. And right now, I don't see anything in question and answers or in chat. Or are any of your resources freely available online?
The resources that were created, yeah, they're available online.
Okay, and you put in a URL. That's great.
Kristen did. Thanks, Kristen.
Yeah, thanks, Kristen.
Oh, that's great. Okay, thank you, Kristen.
Rachel,
right.
we haven't used Kenius yet. And Karen, that's one of the main challenges, trying to keep up to date with all of these tools. So the last time we updated this matrix was last year, and there have been significant changes since then. So it is a challenge to keep up to date. We need to make sure to regularly schedule training and have it on our project list to continuously update this resource now.
And there are 2 questions. How do you keep up with change?
I'll tackle that one.
Okay.
So we do still hold regular team learning sessions, and so we bring up research papers that are pertinent to our particular cohort. And the other thing is that we subscribe to a lot of different e-lists, and we get, I know I certainly get a lot of information through e-lists on what other librarians in the healthcare sector are using particularly, and then go through a periods of trialing. We have regular meetings on any systematic reviews that we're doing, and then how we might be using AI tools to supplement searching in those areas. And then the challenge is really disseminating that information, but we are building it into, as I said, regular training. So when we talk about literature searching, database searching, Medline searching, we also try and bring in any new tools that we think are useful in that respect.
We have several more in the question and answer, but we have to leave it's going to be 12:15 introduce the others. I'm not quite sure. If you can send it, put in chat, perhaps your
We'll can
email
answer the
addresses
questions in
to
chat.
yeah, okay.
Yep.
Okay, great. So we're introducing the next my understanding, the next session should be starting right now. And we're going, I want to remind people, for the new people that have joined us, use question and answers to put in your questions, and chat would be just for general conversation, but question and answers. And we'll try to leave around 4 or 5 minutes at the end of the second session. The second session is can we chat about let's see, it's can we chat about this? Consulting chat GPT to create high yield clinical scenarios and discussion points for medical education. And the speakers are Michelle Connect and Tiffany Fallon. To introduce the Michelle is the senior medical librarian and head of the medical and health sciences collection and user services department for the Charles Schmidt College of Medicine at Florida Atlantic University. Tiffany Fallon is also at Florida Atlantic University, and she's the medical liaison and librarian at the Charles Schmidt College of Medicine. Please help me welcome Michelle and Tiffany.
Okay, thank you for that introduction. Okay, so I'm going to start us out today talking about ChatGPT as it regards to lectures, and then I'll be passing along to Michelle to talk about the use of AI chat to create exam questions, and then hopefully we'll have a good robust section for a Q&A, but we'll see how it goes. So to start out with lectures, the following slides will explore how a mid-career librarian with zero ChatGPT experience, that's me by the way, dives into the experience and analyzes the provided prompts. So when I approach this, on the left-hand side, this is going to be where we are brainstorming. We have our experiences that we are going to be thinking about. As Michelle likes to say, we each come to the table with our own experiences and expertise. So what are you bringing to the table? What topics are you knowledgeable about? But we're also going to think about the curriculum. What are the students currently studying? And what's the relevancy to your session that you're trying to teach them? The content experts are available, but how are you contacting them? And then I know for us at FAU, everything created by ChatGPT should be reviewed by the content experts, which are course directors at the institution, before we're presenting it to the students. And then finally, chat bots for thinking outside the box can be helpful. Even if you don't end up using the scenarios in full, picking out elements can really enhance your lecture to the students and anybody you're interacting with. So now we have on the other side where we're ending up, where we're going, our results. So high yield is a term usually used to refer towards providing information to a test. But are there other ways to become more high yield contextually? So for example, adding examples and concepts or clarifying acronyms, applying a higher learning later in the courses with the same example used in M1, but now you're revisiting topics to really scaffold them to a clinical round or residency conversation. If there's sources, we're all familiar with hallucination of these sources, but we want to make sure that we are checking them out ourselves and not thinking that the course director, whoever is validating the examples that we're creating, is going to check out those sources themselves. And then finally, scaffolding. How can you layer and support to help your learner grow? And this is a bit twofold, as this applies to the teaching of the student, how to navigate what you're asking them to do, but then also how you build the session for relevancy. So for example, if students are currently learning about immunology, which is not your forte, can you pair that topic with one you're comfortable with immunology to become more confident? Or can you utilize ChatGPT prompt for similar topics to your advantage? So here's a starting example that I asked ChatGPT is please provide a PICO question for an M1 class lecture. So in adult patients with acute bronchitis, does the use of antibiotics compared to no antibiotics reduce the duration of symptoms? And this is an open approach that leaves possibilities to something I might not have been aware of, but I'm still considering, is this high yield and what's missing? So I'm going to question the question. So bronchitis is a very nice general topic that's easy. There's no jargon involved. My little synopsis of how I can use this PICO question below mentions the lecture. So I'm automatically thinking, what are the students taking around this time? Would another topic match the lecture block more effectively? And then a clinical scenario is mentioned as well. So did the students already have exposure to what a clinical case is? Or would it be beneficial to provide a clinical scenario at this point? Because I forgot to prompt ChatGPT to do so. So now I'm building upon this. I'm still having a safe territory that I'm pulling examples from, and this is women's healthcare for me. So what about a topic about one aimed at a women's healthcare issue? So in premenopausal women with polycystic ovary syndrome, does the use of oral contraceptives compared to lifestyle modification alone improve menstrual regularity? So I like the topic involved, but is it high yield more than the generic topic of bronchitis? Is there a more current topic the students are studying? If not, is it topical enough not to align? And then in the modification, in the prompt below of how I can utilize it, it mentions patient-centered care, which ties in directly with evidence-based medicine, and that considers patient values. So after finding the best available evidence in the literature, how might the patient discussion of antibiotics and no antibiotics, as seen earlier with the bronchitis example, differ from contraception, no contraceptive conversation options in the conversation pictured here? So again, I'm just building on this. What about a topic about women's pain misdiagnosed by physicians? And this is a more specific topical issue within women's healthcare that I'm aware of and have comfort with. And I'm not going to read it out, but what I found with here is now I have two new terms I can take and run with. So we have delayed diagnosis and underdiagnosis that I can kind of tease out and play around with. So if the conversation doesn't stick with this, if I change it, does the conversation weights of delayed or under misdiagnosis change if we're talking about cancer, for example, or stage 0 to stage 4 is relating to any screening and survival rates, maybe thyroid that has a 99% rate of survival versus brain cancer, which is 36% survival rates. So I know there's a differential diagnosis tie-in that the M1 students are, they have a SIM session that they participate in. So if they're taught differential diagnosis, which is identifying all possible diagnosis, how would introducing a scenario with delayed diagnosis or underdiagnosis change the conversation about treatment plans? And then finally, I wanted to scaffold this to a higher level of learning. So I took the original concept of misdiagnosing women's pain and asked ChatGPT to tie into clinical rounds of residency. And as you can see in this one, I have a lot more to work with and go on. So I just want to highlight and tease out that I loved how this introduced the concept of multidisciplinary care from a team of specialists. And then I have topics on clinical round discussion and residency teaching points. And then lastly, there's clinical pearls that it highlights. And I know I can highlight that in the library resources and plug those in. So with that, I am going to hand this off to Michelle to take AI into the lectures.
All right, thanks, Tiffany.
Oh, well, sorry, exam questions.
Okay, can you hear me?
Yes.
Yes.
Okay. Thanks, Tiffany. In this next section, I'll be discussing how to use generative AI tools to create review questions. And I've specifically included this because our students have asked us to include more practice questions to make our lectures more interactive. And they also want quiz banks to study after our sessions to help them prepare for their board exams. Next slide. So it can be helpful to start with an example of what an expected question would look like. And this is a sample question from the USMLE Step 1 board exam. I'm using this as an example because our students take the exam between their second and third years in medical school. However, the same methods could be applied to any, professional exam. And before we move on, I do want to recognize and mention the importance of carefully considering what information you're inputting and whether or not that information will be added to the large language model of the tool you're using. To avoid issues with this one, I used a sample question that was freely available on the usability website and my institution's own version of Microsoft Copilot so that the input would remain within our system. Okay, next slide. So as you've heard during many sessions of this conference, you'll get better results if you start by explaining the context of who you are and what you're doing and what you want. This is an example of the context I would give the AI tool as well as the sample question I showed on the last slide. So here I'm saying you're a medical educator teaching first-year medical students. You want to create some MBME style questions to add engagement to your lectures and for students to continue to test themselves after the lecture. Start by reading the sample question. So the first result that you'll see on the next screen. So here's the results from the first prompt. It's not bad. It created a feasible question on the right topic. However, once I've seen the initial output, I realized it would be a lot more helpful if the explanation also included information about why the distractor answers were wrong. So on the next slide, you'll see that I can add more detail. I say create 4 more questions focused on study design, and for each question, explain why the correct answer is correct and why any distractor answers are incorrect. So next slide, this is what we see once we put that into ChatGPT. As Tiffany mentioned, it's incredibly important to double check the accuracy of this information and to bring in a subject matter expert as needed to review any content you're unfamiliar with, such as clinical content. And then there's usually one more step that I take that's going to be on the next slide. I try not to go crazy with iterating prompts because I know there are environmental costs for each use, but one prompt that has been particularly helpful is to actually prompt the tool to review its own output and suggest areas for improvement. So Tiffany, you can go to the next slide. I know that one's kind of long. So normally what I say is review the questions you created and brainstorm 3 ways they could be improved. And on this last slide, that's the results. Even when the response seems pretty good at first, I've noticed that the tool can almost always come up with suggestions to make the results even better. Here it's recommending to embed clinical vignettes, which would not only make the questions more interesting to the students, but it would also stimulate real-world decision-making. It's also recommending to add distractor questions and visuals where appropriate. I won't show it live due to the time limitations today, but once I have the questions ready for the students, I could ask the AI tool to format them as Anki cards, which is the open source software that most of our students use to create responsive quiz banks. And as you know, we have limited time today, so we're happy to answer any questions in the chat box, and you can also contact us with any information or any questions. That's all. Thank you.
Checking the chat box and also question and answer box. We do have to move on at 12:30 for our third session. Checking. Nothing in question and answer yet. And chat. Is there a question? What is the software you just mentioned regarding question banks?
I'll put it in the chat. It's called Anki, A-N-K-I. And we can put our emails in the chat too.
Yeah, that's a good idea because it's getting very close to switching out. Thank you very much for your presentations. Yeah, 1 more minute. Anyone else have a question?
Okay, hopefully that was everything. Thank you.
Yes, thank you. And so now Caitlin can put up her slides and we'll start at 12:30. Welcome to our third session. The title is Librarians Leading the Way, Creating Meaningful Generative AI Instructional Programming for Medical Education. Our speaker today is Caitlin McClurg, Caitlin is the health sciences librarian at the University of Calgary. Oh, and I think I'm still a little, I may repeat it because it's not quite 12:30. If people are joining us soon, I'll repeat that we're starting our third session. Welcome to the last lightning talk in this section is Librarians Leading the Way, Creating Meaningful Generative AI Instructional Programming for Medical Education. Our speaker will be Caitlin McClurg. She is the Health Sciences Librarian at the University of Calgary. And please put any questions you have in question and answer. They can also go into chat, but question and answer has a little bit finer features, so we'll check that. And welcome, Caitlin. If you would like to start, I think we're
Thanks,
good
Marcia.
to start. Yes, thank you.
Thank you very much for that introduction and for moderating today's session. My name is Caitlin McClurg, and I'm coming to you from Calgary. If you're unfamiliar where Calgary is, it was the home of the 1988 Winter Olympics, and in a couple weeks in July, we host the Calgary Stampede. So if any of that rings a bell, that's where I'm coming from today. I also wanted to thank the previous two groups for their sessions before me. It was really interesting, so thanks very much. I'd like to begin in a good way with a territorial acknowledgement. So the University of Calgary, located in the heart of Southern Alberta, both acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, comprised of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including Chiniki, Bearspaw, and Good Stoney First Nations. The City of Calgary is also home to the Métis Nation of Alberta Districts 5 and 6. So today, my session, this lightning talk, is really about creating a program around generative AI in rather a swift fashion. I know the last group said that they were new to generative AI, and so am I. And so I'd like to begin with who I am and what the context is of my lightning talk today. So I began my career as a librarian in 2011. So for the majority of my career, I have been a subject librarian. And currently, right now, I support and collaborate with the School of Public Policy, mainly related to health sciences disciplines, the Department of Psychology, and the Cummings School of Medicine, which is our Faculty of Medicine. You may be familiar with undergraduate medical education programs being 4 years. That's a typical length for UME programs. Ours is a non-stop 3-year program without a break. So I support all of those undergraduate medical education students and then the postgraduate medical education program. So that is all of our residents, our fellows, and other trainees. And the programming that I'm talking about today is really surrounding that postgraduate medical education process. So my unit at the University of Calgary is called Libraries and Cultural Resources. And just recently, we have developed a joint initiative between Libraries and Cultural Resources and the Workland School of Education to create an office called the Center for Artificial Intelligence Ethics, Literacy, and Integrity. This is really a student-focused initiative, and we call it CALE, and CALE fosters empowerment, curiosity, ethical use, and literacy development around the use of generative AI. For your information, the University of Calgary does not use plagiarism or AI checkers. So we don't have an official practice, and I don't think many professors would do this, but we're not putting student work through the scanners, nor are we using checkers. Our academic misconduct process is very robust, but we are focused on proactive solutions focused on student growth and education. So for our postgraduate medical education students, we have what we call academic half days. And so every Thursday, trainees have Thursday afternoons off, though many of them have a clinic that goes into that time. But they do have protected time where they have time for research and other training. Most of our core residency programs have a mandatory scholarly project, whether that's a presentation, a study, an evidence synthesis project, which is very popular, so a systematic or a scoping review. And the academic half days is when I have historically come to do library workshops. So teaching people how to use the databases and doing literature searches and whatnot. Very, very recently, as of like November 2024, the requests have come in for the library to lead the way in those generative AI discussions with our trainees. And so I jumped right in to start the skilling up process for myself and to conceptualize what that looks like for our trainees. So my question was, what do trainees need from generative AI? So I talk a lot with them in our one-on-one meetings and in their cohorts, and I really get to know like the pulse of how things are going. And this won't surprise anybody in the room, but one of the key things that residents and trainees encounter is that they have limited resources, and that's time, energy, their well-being, bandwidth, money, etc. Administrative burden, particularly writing patient notes and scope notes, is quite high on the list. And unsurprisingly, if anyone has taught Ovid Medline in a while, there's a fairly low tolerance for intensive training for optional tools. So that is probably not going to surprise anybody. And so that frames how I am approaching generative AI. There's an administrative burden, and there's a rather low tolerance right now for really high skill uptake of new tools. This is a broad generalization, by the way. Also, the academic half days are attendance monitored. So they do have to check in and their attendance is monitored. So similar to any discipline that anyone on the call may be a collaborator with, interest in and experience and enthusiasm with scholarly activity does vary. So we have our keeners and we have folks that really are focused on clinical practice. And so it's trying to find a compelling angle that is interesting to all sorts of different participants in the room. So it's essential for me to position the library and librarian involvement as a value add to the program. So what was my angle? My angle was to present generative AI as an assist to their productivity. And so I wanted to see what productivity tools were available to them. All right, so let's talk about productivity tools. What would be the most beneficial to address with the trainees? So again, I reflected on consultations and feedback with residents, and also needed to know that I had to constrain this within 60 minutes of instruction time. So I came up with a 3-part program. One was to go over AI-assisted scribes, AI-assisted research tools, and AI-assisted project managers and personal assistants. So let's talk about AI-assisted scribes. So I taught the AI scribes not on like social media. So if you were to Google AI scribes, you're going to get pages and pages and pages of options. Part of the ethics and literacy component that I brought to the conversation was highlighting to our residents the difference in jurisdiction. And so I'm Canadian and there's all my American friends on the call and people from different countries, like the Australian group. And so what I wanted to highlight was that there is a difference on how data is used, stored, and privacy directives around HIPAA and PIPEDA. PIPEDA is Canadian, HIPAA is the jurisdiction for US, the US patients and physicians. So some of the options that I demonstrated was a product called Heidi, a product called Makata, which you may not hear about because that's local to Calgary. That's a startup in Calgary. And then a huge one called Dragon Medical, which is a US-based product. So what I learned was that there are health region rules, and even program leadership still looked to me at the end of my session to advise on which tool they should pursue a subscription trial to. And so that's not quite my job because they are under rules and regulations for our regional health region. And so I had to divert that question back to the rules and regulations for the health region. I also found out, if anyone's familiar with EHRs or electronic health records, there are major vendors that actually prohibit or strongly dissuade the use of third-party scribes. And they are now packaging their own in-house scribe solution as part of like the Epic package. That's which is one example. So AI-assisted research tools, we've already heard from the other previous groups on the really popular ones. So I taught GPT-4, something called Cite AI, and I brought in Google Notebook LM. What I learned, ChatGPT-4 remains very popular. Trainees appreciate the ease of use and the results that they are getting. And interestingly, but not surprisingly, residents are actually concerned about the reading level and comprehension of the medical students below them. And so they do have a concern around new medical learners relying too heavily on ChatGPT. They also had a concern around the loss of control, where when we use Ovid Medline or PubMed, we are crafting some control. And of course, we can talk about effective prompts and whatnot to better get the results that we're looking for. But some residents were like, I'm not satisfied that the seminal papers don't necessarily come up in my list of 25 results. And so one of my takeaways where residents are already exploring these tools on their own and are very keen to share their thoughts on the use cases that they've applied to their own work. Finally, I demonstrated a tool called Tascade and a tool called ClickUp. And these were chosen for the comparative features for project managers and personal assistants. So our trainees and residents work on wildly different schedules. They do collaborative work. It's often off the side of their desk unless they are able to optimize their academic half days. And so I wanted to present some tools where they could consolidate some of their apps, consolidate their calendars. There's AI agents where you can give a prompt and it can like talk to colleagues like, Caitlin is waiting for Samantha to complete their task. So it's really cool. However, the trainees and residents are right now hesitant to consolidate their information across apps into one solution. So overwhelmingly, I found that people were interested, but not willing yet to give one app all the control over all the other apps to consolidate that information. And these products happen to require more time and training investment, and they were less compelled at this moment to take that up. So I found that really interesting. So great in theory. I think that many of them just need more exposure to the tools to be really sold on it. So my final thoughts is I actually found that training on generative AI tools is challenging using the limits of free trials, and there's an equity issue. Subscriptions are required for most of these tools, or there's that freemium concept where it's free, or there's like prompt limits or subscription limits. So that is challenging after a while. Again, residents are uncomfortable making medical decisions using these tools, but are enthusiastic about its use in finding workflow efficiencies. And they have concerns about undergraduate medical students possibly over-relying on Gen AI to learn about a new medical topic. Currently, there seems to be a low threshold for complicated tools. The simpler, the better. But they continue to look for the library to distill the generative AI environment into an approachable and digestible concept. So I'm going to end it there with a couple minutes left, but I'm happy to take your questions. Here is my information. I'd love to connect after. And then here is a link to our Kaylee office. So thanks, everybody.
Thank you, Caitlin. I don't see anything in chat yet. Oh, just in time. Let's see. We have 1 minute left. If you have a quick question, please post it in either Q&A or in the chat. And let's see. Are you checking also, Caitlin, the Q&A? Nothing in Q&A. And chat. Can you please post your link again to Yes, good. Yes. I want to thank our speakers who were wonderful today. Very interesting in having a diverse representation from Australia to Calgary to Florida. Thank you, Keren, Moskal, and Cassandra, Michelle Connect, and Tiffany Fallon, and Caitlin McClure. It was a very excellent program. Thank you. Yes, I don't think there are any questions. And if we have, one question and answer. Let's see. Do you distinguish between tools that generate text like ChatGPT versus tools that only find citations like Kenios? Okay, I don't know that tool. You can speak to Caitlin, I think. I think it's still being recorded. Didn't notice that was closed yet.
I haven't heard of that tool before, so thanks for flagging that for me. There's so many. And to be honest, the way that I split it up, I guess the short answer is no. So I haven't distinguished between tools that generate text and then the citations. I did a demonstration for the ChatGPT, and I know that other people on the call used different ones for their examples. And then we have a subscription to something called Cite AI, which is that more robust, like citation narrative response style. And so I wanted to demonstrate, I suppose, what a different tool could look like, but I don't think I was clear in really making the distinction between these two categories.
Let's see. I think questions and answers are okay. And I don't know if we're I think the session is officially closed, but we can chat amongst ourselves if you want till somebody chases us off and closes it. If you want, it's still saying recording.
I was
Anybody
just
wants
thinking
it?
that we should all reconnect in a little bit of time and see
Right.
how things are going, since there's always new tools, and we found this shared interest in medical education
Right.
across all different countries and continents. And
Definitely.
anybody that's
It's been
interested
really
in the
interesting.
chat. Yeah.
Agreed. I was, it's so wonderful. I was listening to, because I was last, it was so wonderful listening to both of you folks go, like the groups go first, because I was like, oh, that's really good.
Yeah.
So thanks so much.
Yeah, it's been really great.
Definitely bookmarking everyone's different sites and gonna go back to them.
Yep.
Well, I think for me, I'm gonna log off. It was so
Yep.
great.
Okay.
Thank you,
That's it.
everyone.
Thanks, everybody.
Thank
Bye,
you for
Good
everyone.
luck with our
Bye.
AI journey. Bye.
Bye.